ourselves a bit more visible on the...
Yeah. So hi everyone. This is about appraisal and revalidation. We've got here Mr. Rebecca Shirley. She's one of our consultants, and she's also one of the appraisers for the trust. And we've got Muntazir Mahdi, who's one of our senior registrars in plastic surgery, who's also recently done his appraisal. And they can give also tips and feedback on how the system works. But today is about showing you guys how to think about it and the things you actually need to do for the appraisal. And it's a very straightforward process, and we'll showcase on my own appraisal here. So appraisal, for those who don't know, it's one of the requirements for the good medical practice. And we are, as trust grades, required to do appraisals because as trust grades, we don't have ARCPs and we're not in training. And this is a replacement for the ARCP. The ARCP is the annual review, and we do this instead to review on our own practice. It's in the good medical practice. That's why it's essential that every doctor must do appraisal. And these are the domains we'll talk about. The difference between appraisal and revalidation is that revalidation is done every 5 years, not every year. And it's more about reviewing all the progress in the last 5 years, making sure that you are still fit to practice. And you should have a few appraisals done. I think they should have 4 appraisals before they do the revalidation. That's why it's encouraged to be done every year. Generally speaking, it's about 4 different things. What you want to show is that you have given the information about what you're actually doing and all the aspects of your work currently, and that you are keeping up to date with the with your professional practice and making sure that you are following the new trends and all the new guidelines as well. And you also should show that you are reviewing your own practice and improving on your own, and you are acting on the feedback. So these are the 4 domains you should work on. And to do this, there are 6 things that we generally are encouraged to provide. So evidence of continuous professional development, or CPDs, as people refer to them, quality improvement activity, any activities you've been working on with respect to improvement and audits, any significant events that you've been involved in, you should also declare them in your appraisal, and feedback. So you should get feedback from patients, feedback from colleagues, and any compliments and complaints that you've had, you should also address these as well. I think that's it. Do you have anything else we discussed in appraisal, or is it?
So I don't know, it might be helpful for me to talk a bit about it from the perspective of an appraiser.
Definitely, yes.
Should I go on to that? So hello, I'm Rebecca Shirley. I'm a plastic surgeon, and as consultants, we're also required to do appraisals. So it's useful for you to know that the person that's doing your appraisal will go through this appraisal process ourselves. So we definitely can see it from your point of view as well. In order to be an appraiser, you do a specific training, and the point of an appraiser is not to give you feedback or to tell you what we think you're doing well or badly or you can improve on. It's to try and guide you through your own thoughts about what you've been doing over the year, to help you just reflect really on what you've done and to try to help give you a good forward trajectory going forward. And I think there's lots of different approaches to appraisal, and I've done 4 quite recently. 2 of them were for people that are trained in the British system, and 2 of them were for international medical graduates. And I think that from the point of view of international medical graduates, it's definitely a challenge, particularly when you come to do the first one. So for me, the first challenge I had was just logging onto the L2P platform, which is the platform we use in order just to book the appraisal. So what you need to do is you need to look at the trust list of approved appraisers and to choose an appraiser from that list. And you can choose whoever you want. It might be that that person doesn't volunteer to do your appraisal, and I've experienced that before, and it's because they may have already had too many people approach them and ask for appraisals and they don't have the capacity to do yours. So I would approach it from the point of view of deciding who you would most like to be your appraiser. I think you can take lots of different steps in this. And I was talking to one of our trainees yesterday about who she'd chosen for her appraiser. Well, and she felt, oh, well, it had to be someone in the same specialty. And that's actually not true. So I've, in the past few years, I've had anaesthetists or I've had a rheumatologist as an appraiser, and I'm a plastic surgeon. And I found that to be really useful just to give a broader perspective on things, because we tend to get very focused on our own specialty. And I would recommend thinking about choosing someone for another specialty, because it just might give you a bit of a broader outlook. I'm on call, so I'm very quickly going to answer this. Yes. I'll be right back.
Sorry, thank you.
Okay. So in the meantime, I can give you a bit of an overview, because from the international medical graduate perspective, it looks quite a bit of a task when you come in there. And I also felt myself, because I have gone through this, so I can understand a bit like the feeling when you are put into this process initially. So like wherever you work, there is some sort of annual review of your service and things. And usually in other countries, it is done by somebody senior to you and with very minimal input from you. But in UK, it's a similar thing. It is done by the trust, but they have put you in charge of that. So you can put your goals and tasks in that, and you have much more independence. And somebody who is your appraiser, it does not affect your job or your salary or other thing like it happens in the other countries. But it gives you a platform to measure your improvement and your day-to-day activities. And it also gives the trust a record of how you are improving yourself, or at least maintaining your qualification, your expertise, and or you are progressing. So take it in this way, that it is something which is helping you to improve your own standing in your own department or in your own specialty, and giving you a stepping stone to progress further. So if some like Mo has mentioned that for the trainees, they have their annual review system, but everybody else who is not in training, they have to do this appraisal. And so take it in this way, and it is the first one is usually very difficult because you don't know what to put, what not to put. And Mohammed is going to describe all these things in that way. And so, as Rebecca mentioned, that it can be from any specialty. So it doesn't necessarily need to be in your own specialty. And and they are usually trained to help you with to do this. They are not somebody who is examining you, and it is not an exam. So take all the stress out of it and try to build up your portfolio with these appraisals, and your appraiser will help you to define things further, because they definitely have more experience and training in that. So take it as a discussion or like an annual review for your own progression, and take your appraiser as somebody who is helping you or guiding you to do that, rather than somebody who is cross-examining you that you have not done this, you have not done that. It's not like that.
Yeah, I would agree with that. So I think that this is a very stressful process, and it really doesn't need to be like that, and it shouldn't. But I myself have also found it quite stressful, because you have a deadline, you keep getting these emails, or you need to do it by this date. It can be quite hard to find a time, and it's a difficult balance. You don't want to feel that you're harassing your appraiser, but on the other hand, you do need to fit it in. So you can organise all this via the L2P system. So you choose an appraiser and then approach them, ask them if they'd be willing to do your appraisal, and then you can ask for them to agree to do that on this programme. Then they click the bottom that they agree, and then you set a date, and it's all done via this platform. And then I would say, in terms of time you need for it, you need really 2 hours. There are different lengths of appraisal. I think mine took nearer to 3, but you can also do it very quickly. So different appraisers will have their own personalities and their own approaches. But what's really helpful is if you can fill the form in as much as you possibly can before the appraisal, because that just makes it more efficient system. And I think it's really important, like lots of things here, to be very self-sufficient and self-motivated. And so you do need to be your own advocate and push yourself forward. We're very happy to answer any questions. So if anyone has any questions, I'd really encourage you to ask them. I am an appraiser. I am happy to take on appraisees. The most recent one I did for an international medical graduate, Muntazir very kindly went through a few hints before that appraisal, and I think that was really helpful. So there were things on there like mandatory training that trainee was not aware of, and it will ask you about mandatory training. Your mandatory training, which is all done online, I forget the name of the program now, it's changed.
It is iAspire.
iAspire. So you have to log into iAspire. It's quite time consuming to do that. But when you do it, these things also are learning opportunities, and they do help you to integrate more into the system. You don't have to get a high mandatory training score to do an appraisal. But I always take that yearly appraisal as an opportunity to make myself get up to date with it. Otherwise, I just wouldn't do it. So when the appraisal's coming up, I try to get my mandatory training up so I can then write 96% or whatever it is. It's almost, well, it's not impossible, but I have never got to 100% on the mandatory training because there's some face-to-face modules that can be logistically hard to fit into. But if you're scoring about 90%, you're doing really well. Some of the training is better than other modules, but there are very useful educational points in there, and you should be doing it. So trying to integrate with all these things actually really help your whole kind of journey into this NHS healthcare system, which is very difficult to navigate. And I think it's just a good opportunity just to sit down with somebody and have a discussion, and they will almost certainly give you some insights into things that you hadn't thought about. And as Muntazir said, it's not a test. It's not any format that's meant to be criticising you. Your appraiser is not there to tell you what you need to do to improve. It's much more about your own self-reflection.
Yeah, I think that's a key thing. It's a way to reflect on your past year, what you've done, and how you can improve the next year. So it's a very good opportunity for that. That should be the focus of it as well. So I've got here my own L2P system. I was just going to show how to do these things so we can demonstrate, make it a bit easier. So this is the older appraisals I've done. But just if you're starting a new one, I'll show you how to select your appraiser. So this is a new one that hasn't been started yet. All you need to do is to go there and click on Request Appraiser once you've logged in.
If you click on it, it will show you the list.
Exactly.
So that they can see it.
I did, so it's loading. So
yeah, so you can see there.
This is a list of everyone who's an appraiser in the trust, and you can find out what their specialty is and how many appraisals they have done and so on. And you can request one of them if you know them, but it's always good practice to send them an email beforehand and tell them about yourself and that you want to do an appraisal with them. If they say yes, just put a request here, and once they accept, they will be updated on your appraisal on the system. So that's how you choose your appraiser. And once you do, I'll show you on my old one, there will be a few sections that you need to fulfill. And once you do that, you'll be ready to have a meeting with your appraiser and go through it together. So this is when I did my own appraisal. I think it was in July. And essentially, you start with your own personal details, which is straightforward. Your scope of work, which is your current practice, what you're currently doing and your current job role. And if you've done an appraisal before, then you can also describe the changes you've done.
Yes, and so in terms of sometimes you struggle with the detail of work because you feel lost at the work you have to put on there. So when you were selected for a job, there was a job description that what you are expected to. So that is a good guide to put all those things there. So you can take it from there and just rephrase it over here that this is your detail of work, what you do.
Yeah, exactly. So a summary of what you're actually doing in your role. And if this is your first appraisal, you don't have to worry about this section. But if this is your second one, you can describe what you've done since then and the changes in your own practice. If you have stepped up to another level and so on. And the last section will always be left empty until you have a meeting with your appraiser, and they will go through it together and add their own comments in the meeting. So this is the scope of work, which is pretty straightforward.
And I think just a point there for Mo, when you do your next one, you need to write as a separate category your teaching fellowship, and then you can summarise this work that you've been doing.
Exactly.
So do try to think about your different roles. Many of you will have teaching roles, and try to think of other roles that you can form, because these things are always useful for your future interviews. So whatever your chosen career path, you're going to be going through an interview process. So this is a really good opportunity to look at how can I strengthen my CV. So you may well find that you've just got your basic job description, but start to think about what other job roles you can have, because there are lots of roles you can have in education, research, audit, these kind of things. And when you start to think about them, you can put them into further categories that just summarize the different aspects of your job.
Yeah, exactly.
Yes. So one more thing to mention here, that even if you are volunteering, it is not non-NHS, non-medical work, you can still put that here. So for example, I volunteer in a school, so I have put it as a separate job role over there. These things matter for your CV and for your future job and other things, because volunteering in the other services or places is also highly regarded here.
Yeah, absolutely. And I think it just helps you. What I always find is I look back over the year and I think I've done so many things, and it's very easy to lose sight of these. I think the other thing that is good advice is to try to keep some contemporaneous records, because sometimes you do things that's very easy to completely forget about. So I would almost have a file for appraisals and put things into it so that when you come to do it, you don't forget things. It's really easy to forget significant things you've done over the last year.
Yeah, just make a folder in your laptop or computer and just keep on putting things in there. So at the end of the year, you don't have to look for the things here and there.
Yeah, being organized makes a huge difference.
Yeah.
Exactly. So yeah, that's the scope of work, and the you can put here your annual appraisal. My previous one was in a different system, so I couldn't upload it here, but I emailed it to my appraiser at the time, and they looked through it as well. But you can, if you've done an appraisal before, you can upload it in this system as well. And personal development plans is when you start doing some reflection. So this is your own plans of how you're going to develop yourself. So there are, if you've done an appraisal before, again, you can write what you've written before and how you've achieved it. Though this is the one I did when I was in Bristol in 2021. I had 3 PTBs at the time, so getting more experience with unwell patients and applying for core surgical training and research and audit and so on. And I've written here as a reflection what I've done to achieve these goals in the last year. So to improve my experience of working in A&E and so on, I've done ALS course, CRISP course, and so on. So these are things that I made as a goal for myself, and how I have reflected on how I've actually achieved some of these. And again, once you've done these, in the meeting, you can discuss this with your consultant or the appraiser, and you can write a comment on this as well.
Yes, so there are a lot of things you can put in there. Like if you are planning to attend a course, you can put that as your PDP. If you are in surgery and you are interested in a specific aspect or specific procedure, you can put that there, that I want to get more experience in this procedure. And you can put like a number that I will do about 10 or 20 of this procedure in a year. And like at the end of your appraisal year, you can put that evidence as your logbook as an evidence of achieving that, or some like this ICP thing, like work-based assessment.
Yeah,
you can put that there as an evidence of achieving that. Course certificate can be evidence of achieving that that course.
Yes, it's useful to have goals for yourself and think of how you actually work towards these goals. So it's a way to reflect as well, like we said. There's a section about well-being, how you are doing, and you can also put a reflection on whether you're doing well or not. If you need any further support, you can also discuss this with your appraiser at the time.
Yes, this is all these things you could put, like if you're feeling stressful about certain things, you can put this there. So this is an opportunity for you to discuss, because your appraiser can give you better advice and how to get support for that thing.
The other thing I was just going to say about this is sometimes this can seem like a really difficult, onerous task. And for those personal development plans, you're on no obligation to write loads and loads. You might choose just to keep it really short. So you can see there's lots of different sections of this. There's quite a lot of writing. It's absolutely acceptable just to say something that you're doing. But if you can keep it very specific and time dependent as well. So in July, I plan to pass this exam, or by the end of the year, I plan to have completed this course, or I want to become competent at this procedure by the end of the placement. So you don't need to write lots and lots. It's absolutely acceptable to write one sentence.
Yes, and one of PDPs you can put it as like maintain your mandatory and role specific training. So this will make you one of the PDPs. It's already compulsory, you have to do it, but you can put it as one of the PDP, and you don't do more than 3 or 4. Yeah, if you put too many, then it's
a very personal thing. Yeah. So it's what is a challenge for you, and that's your goal, not anybody else's.
Exactly. So it's all about you and how you reflect on your own goals. And this is the section for the CPD, or continuing professional development. So this is where people are asking a lot of questions. So a lot of this is about showing how you've improved yourself. And this can be through attending teaching, attending courses, doing quality improvement projects, doing audits, and so on. So all of these count as professional developments. Some of them will be accredited for formal CPT points. For example, the CRISP course that I did was for 12 points, so you can put it here. And there will be an option to upload the certificate or whatever you have done. So if you've done any courses throughout the year, if you have attended any online teaching and so on, and you have a certificate, you can put it on there. And generally speaking, CPT points are counted, correct me if I'm wrong, but I think it's an hour for 1 point. Yeah. If you've done a teaching for 2 hours, for example, you can put 2 CPD points.
Yeah, so it's worth saying something about these CPD points. So continued professional development. Some courses apply to get these CPD ratings on them. And I think maybe for GPs, this is important. For me, in my entire career, CPD points has never been important. As Mo says, 1 point equates to 1 hour. And I usually easily get 50 of these in a year, but you just have to do 1 hour of work to write it. And nobody's going to be checking that that's been definitely verified as worth 1 CPD point. If you go to a webinar for an hour, that's 1 CPD point, and then you add it all up to give your total. And you can see there that Mo's got 48. I'm sure that in reality, he got more than that. Yeah. And that's what we were saying about just trying to keep a record. Since COVID, webinars are just something that most of us are spending hours on, and it's very easy to lose track of those. So having a list that you add to prospectively is a very helpful way of keeping tabs on that.
Yeah. It's just spending like 1 minute whenever you attend a webinar, whenever you attend departmental teaching, just put 2 lines over there in just make a Word document over there in your folder for appraisal, and keep on putting this thing with date and what you have learned, just a bit of reflection that what you learned there. Yeah.
Some people write reading journal articles. Yeah. I tend not to write that down, but if you are feeling that you're a bit low on points, that is something that's completely acceptable to do. And yeah, doing it real time makes it a lot easier and less stressful when you come near to the deadline for the appraisal.
Yeah, so it's all about how you've actually continued your own professional development, essentially from the name. And there will be a section on quality improvement, a separate section. So any audits or quality improvement projects you've done, if you've worked for so and so hours in this project, you can also add it here for more points as well. So any audits or so on.
Yes, you can put in there if you have attended any MDT meetings, if you have attended any morbidity mortality meetings. So this is also important that whenever you routinely attend these things when you are working, and the only thing is you don't keep record of that, and at the end of the year you don't have that record. Sometime in the department somebody is keeping attendance of these things. You can ask them for the record of that so that you can put it as approved. But otherwise, just make a document and a table, like for similarly for the CPD, just keep on putting these things there. So at the end of the year, when you need it, you just copy and paste that there on your appraisal.
Guys, we can't see you, but if anyone has any questions, just shout or say something, and we'll always answer the question.
Yeah, please ask some questions.
Yes.
Okay. So any questions about any of this so far? Okay, good. So next section is about significant events. So I haven't been involved in any significant events, so I didn't put anything there. But if you have been, you will have been notified, and you should be aware of this as well. There will be, I'm not sure if you can give more insight.
So I'll say a few more things about significant events. So first of all, it might be something that you want to talk about that's a significant event, or it might have been something that's been handled officially. All of you at some point will be involved in significant events, and it doesn't necessarily mean that you've done something wrong. So for example, if you're in theatre and there's a never event and a retained swab, this is somewhere where you should tick the box and write comments there. Sometimes they do involve a mistake, but these are really important to declare and just to write something about there. This does not require an in-depth reflection. There's been a lot of concern about writing your honest thoughts since the Bawagaba case, some of you may be familiar with, who was a registrar in Leicester, and on her first day back from maternity leave was involved in a case in which there were a number of errors in the system, which meant that she was left very unsupervised with problems with getting blood results, and a child with learning difficulties who subsequently died. And there was some controversy because her reflections were used against her. So you don't need to write anything about how you feel you made a mistake. This is not what this is about. And also this is a confidential document, so this information is not something that would be used against you. But if you have been involved in any significant event, it should be discussed here. We widely acknowledge that it's very stressful when you are involved in one of these. I've been involved in many over the course of my career, and it will happen to you inevitably. It doesn't mean something bad, it's just the nature of medicine. Significant events happen frequently, and yet your appraiser will be able to go through this with you.
The next section is about feedback. So here you can collect patient and colleague feedback. There's different system to use, but I've done it on a separate system. I've done it on ICP instead, and my appraiser accepted that. But generally, you can do it directly from L2P. So you can use it to request feedback. You just write the emails of your colleagues or emails of patients once you've asked them to give feedback. And you should collect enough feedback that you can reflect on with your appraiser as well. Like I said, I've done it on a separate system, so we've gone through it together with my appraiser then, and this was fine. But generally, you can do it on the system here. It will all be populated here as well.
So yeah, I always encourage people to do this. So you have to do it for your revalidation. And when you're getting to kind of the appraisal before your revalidation, it's really worth start thinking about this early, because you have to formally send out feedback to your colleagues and your patients, and it takes time to get those results back, and they have to come back in an anonymized way. So I think you can print out forms. You shouldn't personally give them to patients, but then they need to be collected, and that's supposed to be kept anonymously. So it's crazy really, but I remember getting an envelope with all the comments in, and I wasn't supposed to look at that. I was supposed to then hand them in to the appraisal team that then go through them, and your appraiser can go through them with you. But I found it to be a really useful experience, particularly the bad feedback, because that's how you really learn about what things you're not getting right and need to improve, and that can really help you with your personal development in your career.
Yes, exactly. That's how you learn.
Yes, like for the colleague feedback is much more simpler and easier. That you know them, you just put their email and send it to them, and they will do it. But the patient feedback is a bit tricky, a bit difficult to do. But the easier tip will be like if you are in a clinic and you can give it to the receptionist or the nurse there, or you can hand out the forms themselves to them, and they can fill it and they can put it in an envelope and give it and ask some nurse or the receptionist to collect them anonymously. And or if you are in a ward, you can, if you have seen some patient, had interacted with them and ask them permission that we are happy to give the feedback and give them forms, and they can give back to the charge nurse or any patient nurse over there, and they can collect it for you. So in this way, then you can give it back to the appraisal team.
I just have a quick question, if that's okay.
Yeah, of course.
So in terms of colleague feedback, if we've done a tab on our portfolio, could we use that or not?
Yeah, team assessment of behavior. I'm not sure if you can integrate it. If you've got some of these, I think you can, but I'm not sure exactly. So tab is something medical student foundation doctors use on similar to ICP.
Yeah.
Team assessment of behavior. So it's asking colleagues for feedback on their own behavior in professional practice. Is it something you accept?
Similar to like MSF.
Yeah, so I think when it comes to the revalidation, I think you have to use a different system actually. So on that tab, what happens? Do they give like free text feedback, and there's various things that have to rate whether you're sort of poor through to excellent, something like that, is it?
Yeah, essentially. So during one of your one of my rotations, we had to do a tab. So you have to select 10 people from varying different, like from consultants to like senior nurses and so on, and they just rate you in terms of any sort of concerns or no concerns based on things like communication, patient interaction, so on and so forth. And then I went through that with they're anonymized, but I went through it with my CS and ES.
Yes.
So I was just wondering if that was possible to be translated or not.
So I think when in that situation where it says, have you been involved in any colleague feedback within the last appraisal period, the answer to that is definitely yes. And then you can write in that box that you've done that. I'm just not completely clear with the revalidation, if that's okay. We need to just double check on that.
No, I think for revalidation, I think we have to do this L2P 360 multi-source feedback. You have to that will
I think so too.
And you have to do that feedback only once in your appraisal cycle. So like I will suggest that like if your appraisal due is 2025, then do it in your appraisal cycle. In your appraisal revalidation is due in 25, then you do it in 2024, just 1 year before. So by the time that it will be ready, because it takes 2-3 months for you to complete all things. Colleagues' feedback is not much a problem because you send the emails. Most of them will respond quickly. Some might be busy and might miss your invitation and things. You can remind them, but it usually doesn't take much time. But the patient feedback, you have to collect a certain number of feedback, and it depends upon how much your duties, how are your duties, how many times you are in the ward, how many times you are in the clinic, and where and how many of the patients agree to give you feedback. So it might take some time for that. So I would suggest do it 1 year in advance of your revalidation and do it on this system. Because
I think they do that. Can we go through that?
So I have not done it. Yeah.
So I think it's the separate section here. So here is the colleague feedback. So I think you can use the system from here to do it.
And if you go back to colleague feedback, there was some notes that you could look at there. Colleague patient feedback. If you go top right, look, there's notes there.
I think it's like messages.
What's this? Download notes. And then there was another box next to that. Because what I remember for the patient feedback was printing out forms, and I think there's a certain number you're supposed to get. It's not that, is it? Like all of these, so many systems, you lose.
Oh, it's here. It's actually here. Multi-source feedback. It's a different tab.
It's there.
So yeah, mine is late, but essentially you can add colleagues here and
print
back.
Patient pack.
Or send the link to an email.
Okay, so send link to patient. So yeah, so I think the easiest is to print them, and then when you're in a clinic, you can ask them to hand them in, give out some brown envelopes, and ask someone you're not supposed to collect them yourself, because that's deemed to be like coercion, or that might influence the way that they answer. But usually they just tick a few boxes and then they can write a sentence at the end. So I found that to be, if you have a system and you're in a clinic and you're there giving them out, it's actually not too onerous to do that. But as Muntazir said, try and do it within the year before, just so at the last moment you've not got loads of things that you're trying to keep up with. Yeah, so this is for the patients, yes?
Yeah. So
and then, okay, so that one you can either email them or print. I think printing's easier. And then for the colleagues, just go to that one again, how you do that.
Well, here, I think you just add.
For colleagues.
That's right. And then it sends you an email from the L2P system. Yeah.
There's one here.
Yeah,
so that's something I need to work on then.
Yeah, so here it says you need to have at least 17. So send a few more, and then a few that don't answer, it's fine.
Yes, and it is not necessary that it all should be the senior colleagues. It can be consultants. It can be somebody who is working at the same level as you. And you can put some secretaries. You can put some nurseries with some nurses, secretaries, physiotherapists. So just try to build a bigger mix of the things, or you can even ask them beforehand that if they're happy to send you, if you're happy to do the this feedback for you. Yeah,
so you can collect that. Apparently, you have to make sure it's on the 360 platform for revalidation. So try to work on that. Okay, and there's any other questions? Great. Okay, so I think this one is for the informal feedback you get. So if you had any letters or any thank you letters or any formal complaints or anything like that, you can also put it here.
The formal complaints, usually the revalidation team will put them over there.
They will
if they are there on the system. Otherwise, they will just send you, they will upload it on there that there are no formal complaints against you. And otherwise, like compliments, some patient gives you a greeting card or something like that, keep it with you. Or like what I do is, it's difficult to keep the paper record, so I just take a picture and save it in my appraisal folder, so that when the time comes, I have that there. And on that also, you have to remove the identifiable patient details. So on this picture, you just like black out this patient name or things, and the rest of the things, leave it there.
So I take a slightly different approach, and you can approach this however you want, so that there's no right or wrong about it. But I found to be like, maybe I'm slightly older generation, I find any IT things kind of frustrating. The other thing that I noticed was that this has quite a limited capacity in terms of storage. So I once put something on and it just crashed the whole system because it had too much memory. So I don't bother with that at all. I just take a pile of the cards and I just show them to the appraiser, and it's a nice record to have those things, but you don't have to put them all on there. They encourage you to do it, but I've had them coming back saying, oh, this is identifiable data, that's too much memory, and so from there on I just don't put it down at all. But I think, as we've said, this is for your records. You're not duty bound to upload everything, but it's nice to keep a record of correspondence from patients for sure. And complaints, again, as we said with the serious incidents, is that you may well have been involved in a complaint, and sometimes you've been in a complaint that's not, it's not even targeted towards you, but it's useful to keep a record here because this is you reviewing and reflecting on your previous year of work.
Yes, and what I've noticed that sometimes they put any datex on which you have done on your record there in this section. So you can have a little brief reflection on that, what did you find
Yeah,
out
so
and
I
what did
think
you do?
they tend to email
They
you
tend
that
to-
just when
yes.
they know your appraisal is
Yes.
coming up, and you can add in datexes that you've been involved with. But again, I don't think that's a bad thing. I think
Yeah.
we're encouraged to fill in datexes for everything. Sadly, we make mistakes and things go wrong,
Yes.
and this is a part of life.
Yeah, it might not be your mistake or something. If you have identified something and noticed it and done a datex, so that comes in also in the section of quality improvement. So you can cross-reference that thing in the quality improvement activities also, that you have identified something and you reported it.
Any questions? Okay. So if you've done any teaching, I think you can put it here. I think this is only if you're being supervisor. So most of us will not be a clinical supervisor at this point. It's mostly for people who are consultants who have professional training in that. So you can put a section here, but you can just ignore this section.
Yeah, so I think for all, I'm just guessing for all of you that are here today is that you are not a medical educator.
No.
Yes.
And
That's for people like me who have supervisees, and I'm a clinical and a medical educator.
You have to put a lot of other things there then.
Not really, no, but just, yes.
And this is more about the things I think you're proud of. I used it to summarize what I've done, but it's more about achievements and things that you've overcome or things that you've done. So you've done something that you're proud of, you can put it here, and the things that you are aiming for, so in achievement as well. So what you're aspiring for in the future as well. This how you use it, or?
Yeah. I think that's not an example of the thing. So it's just putting like a milestones for your career, like what you have achieved, what you're planning to do. And I put it like aspiration as the short-term goals and the long-term goals. So you can do it in your own way, whatever way suits you.
So that's one of the sections. The rest is pretty straightforward. So this is just a declaration. If you have anything to declare, you can write it here. If you have not, then you can just say no. And indemnity, you should be an indemnity cover. This is highly recommended.
So it's usually like MDU or MPS membership, which cover you for medical malpractice. So I usually put my certificate of indemnity over there.
Yeah, I have one, but for some reason I didn't put it on. Not sure why.
Yeah, so I think that all of you should have medical indemnity. If there is a payout, then usually what happens is that the trust and your medical indemnity cover split the payment. And statistically, we're all likely to have one of these during the course of our careers. So you should all have medical indemnity cover.
Yeah. There are a few ones you can look into. So additional information is for anything else that's not in a particular section. So I put here my lookbook for surgical lookbook and so on. And do we need to put the e-learning here, or is there a separate
So
section?
yeah, you can put that.
Yeah.
There's mandatory e-learning, that how much percentage you have it, and whatever is remaining, you can put it there.
Yeah, so now it's on iAspire, but when I did it was on ESR, so I just put it here. And you can show the I put a screenshot, I think, of the percentage of what I've done and so on. So it just shows what you've done and so on. So just providing evidence that you've done it, or just show the appraiser your own login. And this section is very important for me. So this is when you're proposing what you're going to do in the next year, and when you set your own goals for the next year. So this is something you can reflect on when you do the next year's appraisal, but it's also useful to have a goal for yourself as well. I put the things that I wanted to work on, and you discuss them with your appraiser, who can also give you advice on how you can achieve them. But it's essentially about you reflecting and putting your own goals, what you want to do, and organizing your thoughts. It's actually very useful for this as well.
Yeah.
I think as well, it's good to be ambitious here, because you don't have to meet the goals, but I think the more ambitious your goals are, the more likely you are to move forward.
Yes.
So you don't be put off by thinking, oh, I'll never be able to do that. If it's a goal and you want to do it, I would put it in and then accept you may not reach it in the next year.
Yeah, exactly. And can always reflect on what you've written and see what you have done.
Yeah.
So the last section is just for uploading all the evidence. I think it will have buttons for uploading all the evidence that you've done, and you can write it here. So it will match to the things you've written here, and you can just upload any certificates or anything like that. It will summarize all the CPT points you've had as well. And that's it. So I think.
Well, you say that's it, but this bit, the pre-appraisal preparation, this is actually takes quite a long time. So I think everyone thinks that's it, but you do have to write something in each of these categories. And this is all about good medical practice. And you can see there it says hide notes, which may help. If you click on that, it gives you a bit more of a hint about what kind of things to write. Again, people have different approaches. I wrote a lot in mine. You don't have to do that. You can actually write a little, but you need to write something in everything. So just don't miss that as a final page, just to get it completed.
Right. Yeah.
So basically, appraisal is all based on these 4 domains. So that's why they, at the end of it, they want you to write something over there to prove that you are aware of these things and you're trying to comply with all these things. And there are hints over there, this like a
always show notes.
cheat book and cheat codes over there. So you can look at that and think of it that what you have done during the last year.
I think one of the things I felt as an appraiser signing these off is that it asks you about are you convinced that they follow good, and you have to tick a box. So you have to make sure that's all been filled in before you really look and say, yes, I think this person could be signed off. So this is an important stage. And I think that my memory of the appraisals I've done is that this is one that hasn't been filled in, and then the appraisees had to go off and fill it in before I can finally sign it off.
It is tricky because you lost for words when you have to describe your things over there.
Yeah.
So, but
and again, you don't have to take ages to do this, but just go through, try and look at the specific things they're asking you and answer on all of those in turn.
Okay. And the next sections will be about checklists and just making sure that you've fulfilled all the sections. So if you've done any of these, you can write yes or no, and if not, you can add more information and so on. So scope of work, PDPs, all the sections we've gone through. You just sign it here, and if there's any anything missing, you can add on. And so this is your own checklist, and then you submit it. So submitting is here. Submit to appraiser means that you've submitted all this information, and the appraiser now can see what you've done and can go through them before the meeting. They can read. If anything is missing, they will let you know, and you can also update it.
Yes, and try to send it to your appraiser about 2 weeks in advance. This is what they recommend, so that they have a bit of time to have a look at that, and by the time you have meeting, so they are prepared also.
Yeah.
Yeah, and again, there's a personality thing there. So I'd be lying to you if I said that I'd read it anything other than the night before in a bit of a rush. And sometimes we've sort of done them, and I have been reading through as we've gone along, depending on sort of time and other commitments.
Yeah.
But I think, do think about it's really good practice for being courteous to other colleagues.
Yeah.
So first of all, we're all busy, so as much notice as possible in terms of organising a time to do it. I've certainly had one of my appraisees who missed all the deadlines, loads of emails coming all the time about having missed it, and the onus is on you to organise it. So in that situation, I was just aware that I'm getting lots of emails, this person has not been organised, and I then feel the need to sort of hassle them a little bit, but try to be organised and in control of this, and give as much notice to your appraiser as you possibly can.
Yeah. Make it easier for them, to make it easy for you. And the meeting will be here. It will just be updated when you're doing the meeting with the appraiser. And after the meeting, you can this is a summary of what you've done and your goals. You can write it here so you can go through that as well. And I think the appraisal outputs is when everything gets signed off by the appraiser. Again, will all be done in the meeting. And after that, it's just the checklist to make sure that you've gone through all the sections together. So this, again, it's with the meeting itself, and then it will be
Submit it to the appraiser.
exactly once done. Then both of you will sign it off and sign it and send it to the appraisal team, who will then review and write reviewed and satisfied in it. So this will be done. And you only need to do this once a year.
Yeah. So I think then the responsible officer, who is Andrew McLaren for all of us, then has to sign off everybody's appraisal.
Okay. And for like a revalidation is every 5 years. So you should have like 5 appraisals during that time. And then your responsible officer, who is your trustee or who is trustee or medical director, who usually does a recommendation to that. And if some of these things are delayed because of any reasons, and they think that your things are not ready for revalidation, they can still ask GMC to give more time. So you don't need to get too much stressed about it. If there is a delay, usually for the appraisal, they say that you have to do it within a year. But in some circumstances, exceptional circumstances, they can delay it for about 2-3 months maximum. Okay, so that is also an option. It can be done in this way if you have some unavoidable circumstances. But try to do it in time so that your things are ready. And even for your revalidation, you need 5 appraisals and you need a patient and colleagues feedback. So these are the 2 things. And when your responsible officer is happy with that, he will send a recommendation to GMC for revalidation. If he's not satisfied, he can give you some more time. And they can usually give over 3 or 4, 6 months usually. To do that.
But yeah, I'll try to aim to do it in time, so to make it easier for everyone and for yourself as well.
Yes.
Okay, any questions from anyone at all? Everything okay? Everyone happy? Great, and thank you very much for coming, both of you. Been very helpful. Thank you. I hope it's useful for you guys. Like I said, it's all recorded, so we'll have it on YouTube as well. If you have any colleagues who want to see it as well, you can let them know. I'll put the link on the WhatsApp group as well. And thank you everyone for coming.
Good luck in your appraisals. Just the filling in of them, which, as we've said, is all for your own benefit and not being tested on anything at all.
You're very welcome. Thank you. Okay, see you guys.